on the Teams chat. I can just see the slides. I can't see the chat. So if you ask questions during the training, I will not be able to answer. But the CVS team and your regional manager will answer you by email after the training. So don't hesitate. It's very interesting to have your question. The agenda for today, I will start with the Y connectors, my shell and squid. Then the inflation devices, dolphin and flamingo. And to finish, the compression device, seal1. The cardiovascular BU is divided in 3 ranges, the surgery, the vascular, and the interventional. And today, this is the interventional training. So first, to start, I want to give you some knowledges about the environment. I'm sure you have some information, but I think it's important to have all the same information to understand the presentation. Some data, prevalent cases of total cardiovascular disease were 217 million in 1990, and in 2019 it was 520 million, 20 million. So it doubled. It's very huge, and the cardiovascular disease are the leading cause of death globally. So the market is very important. Regarding the arteries are divided in coronary arteries. There are the heart arteries and the peripheral arteries. They are all the rest. So you will hear the coronary angioplasty, peripheral angioplasty. So coronary is for the heart. The main pathology of the arteries is the atherosclerosis. And this is an alteration of the arteries' internal walls with the creation of an atheromatous plaques. You can see here the plaques. These plaques are mostly made of fat deposits between the intima and the media. And this atherosclerosis can cause stenosis, which is a decrease of the vessel lumen diameter here. It can cause aneurysm, which are bulged in the wall of weakened artery. For tomorrow, we will focus on stenosis. And this stenosis can cause blood flow alteration and the muscle with lack of oxygen. And this in coronary artery, it will lead to pain, shortness of breath, heart attack. In peripheral arteries, it leads to limp, pain at the rest, gangrene, and in cerebrovascular arteries, it can lead to stroke. So to diagnostic this stenosis, the doctor will use X-ray imaging with injection of contrast media, and he will detect the blood flow blockage. Here you can see a stenosis. The treatment is an angioplasty, and it is a mini-invasive procedure. You have a catheter with a teeny balloon which will be guided through the artery to the blockage. Okay. Then the balloon will be inflated to widen the opening and increase the blood flow. And very often, a stent is placed during the procedure to keep the artery open. Okay, so I think you have all the information to understand the rest of the presentation, to understand what is an angiography and angioplasty. Now I will present the Y connectors, my shell, and squid. few information regarding all the Y connectors. First, the indication. The Y connectors are used during angioplasty in coronary and neurology. They are used to maintain seal limit blood leakage during the insertion, the use, and the removal of material like the catheter or the stent. They are used to inject fluids and monitor the pressure by the side access. The target, they are the interventional cardiologists and the interventional neurologists. The Y connectors are classified according to their opening closing system. Okay. For example, you have screwing system. Okay. You have push-pull system. You have push-push system, like for my shell. I will explain just after how to use it and what is the system. The screwing system. The screwing system, to open the valve, you have to unscrew, and to close the valve, you have to screw. You have to screw the button. So the benefit for this sort of Y connector is that you can adjust the opening and the closing of the valve by turning one turn, two turn. You can slightly open for easy movement of the device. Okay, see, you have turn, for example, switches. You can move the device. But if you need to have a complete closure, for example, when you will inject, you need to have a complete closure to avoid that the material will move. You can close completely. So the advantages are that you can adjust the opening and the closing of the valve. There are disadvantages. The disadvantage is that you need to do several rotations to open and to close. So you have more manipulation. And as you have more manipulation, it is longer, so there is more bruise loss. Okay. Then you have other system, like a push-pull system. Okay, you push to open and you pull to close. Okay, you push to open, you pull to close. Okay, or with the my shell, you push to open and you push to close. This sort of Y connector have some benefits. All of these connectors have the same benefits. The opening and the closing is very fast, so you have less blood loss. It is simple to handle and you can use with one hand. But there are disadvantages. You have not the possibility to adjust the opening and the closing of the valve. You can just open and close. Okay, and the closing is less tight than a screwing valve. So when you inject the contrast media, the material can move a little, and you will see that some engineers have developed other connectors. They are connectors with a push-pull system plus a screwing system, and you have all the advantages of the screwing valve and the push-pull valve. You have a better maintaining of the device, and you have a very good sealing. Just to explain how the Y connector is connected. The connector is connected, you have the patient on this side. Here, the Y connector is connected to the catheter guide, okay? And in the other extremity, you will insert the material. Okay, so now I can explain you my shell. So as I told you, my shell is a push-push system. This is the button to push, open and close, okay? This is the main assets to insert the material, and this is the side access. My shell have a inner diameter of 7 French or 9 French. You have the choice. And the maximal pressure for injection is 8 atm, and it is sold with a tubing of 20 centimeter and with a stopcock to inject fluids and monitor the pressure. So just a short video to know how to use my shell. There is no sound, it's normal. Okay, so I think now you know how to use it. The benefits of this system is that as it is a push-pull system, is single, we can use it with one hand. You have it is ergonomic, so you can use it with a very good handling. And as we explained, the guide wire and the catheter can be controlled through the closed valve. So you have a minimized manipulation, a limited fluid leakage, and a limited pressure drop. The valve is in silicone, so you keep the coated catheter integrity, and you have the choice between 7 French or 9 French. So it is suitable for kissing. That means that you can introduce multiple devices in the valve. And as you have a tubing with the stopcock, you can inject contrast saline. This Y connector is available alone or with accessories. And these accessories, we have 2 torquers, a screwing torquer. The torquer is used to facilitate the steering of guide wires. So we have the screwing torquer, and we have another torquer, which is alligator. And we have metallic guide wire introducer, which is used to facilitate the introduction of the guide wire through the valve. Some advice to use my shell, but they are advice for other Y connector like squid. You have to use a 10 centimeter guide wire introducer. This is the guide wire in the kit. When you insert the guide wire introducer, you have to open the valve. It is very important because the risk is to damage the silicone valve. And when you introduce medical device, for example, stents and balloon, they have a fragile extremity, so you have to open the valve. It's very important. And when you aspirate, you have to aspirate slowly through the stopcock to avoid creating a suction phenomena on the valve. But this advice is for all Y connector. Okay, I have finished with my shell. Now let's follow with squid. This is the second Y connector. It is very simple. This Y connector have a push-pull opening closing system. And here you have the main access, you have the side access, and the tubing with the stopcock. This device is manufactured by Artesis. The inner diameter is 7 French. The maximum pressure is 8 atm, and it is sold with a tubing, with three-way stopcock, a tubing of 20 centimeters or 50 centimeters, but you can have it without tubing. The benefit of the squid is that as it is a push-pull system, you can use it with one hand. It's very easy to open and close. You have minimum manipulation, okay? You can control your guide wire through the closed valve, as the same as for my shell, okay? So you have limited bruise loss, limited pressure drop, and you have a silicone valve which preserve the catheter coating. This Y connector is transparent, so it is very easy to remove the bubbles, and it is ergonomic. It's you have a very good handling, and it is compact, so it is space saving. And you can have a two-way stopcock to have drug injection and contrast and saline. It is sold alone or by kits. The accessories are the same as for my shell, but you have, in addition, a plastic insertion tool. And this plastic insertion tool is used to facilitate the microcatheter introduction. It is mainly used for neurovascular. Here are the references. The advices are the same as for my shell. Okay, so I have finished with the two connectors who are currently on the market, my shell and squid. But we have another Y connector, which is Swan. It was commercialized a few years ago, but the commercialization has been stopped because of changing in the production. The factory will now be in Mauritius. So for the moment, the Swan is not commercialized, but it will be on the market, we hope, at the end of the 2023. So just a few words about that, and when it will be launched, I will go back to you with more information. So this is a screen opening closing system. It has a 20 centimeter or a 50 centimeter tubing and a two-way stopcock. The inner diameter is 8 French, and it can be used with the maximum pressure is 18 with tubing, without tubing, sorry. This device is sold without tubing and with tubing with stopcock. To have everything in mind and to be very clear, I have a slide with a comparison between my shell and squid with the information to retain. You have my shell with an opening closing system. This is a push-push. Squid is a push-pull. The inner diameter for my shell, you have the choice 7 French or 9 French. For squid, 7 French. And for my shell, there is a tubing with a stopcock, and the tubing is a 20 centimeter tubing. For squid, you have a tubing of 20 centimeter or 50 centimeter with stopcock, or it is sold without tubing. Let's now have a look on the competitors. First, the competitor for screwing Y connectors. There are a lot of screwing Y connectors on the market, I know, and they are very similar. I have the main competitor from the main company. We have Merit, that it has two Y connector, the Passage and the Access Plus. Passage is 7 French and Access Plus is 9 French. There is the Bibron, the name is Y connector, and you have the Python Y adapter from Medtronic. And as I said, a lot of other competitors. And then you have the main competitor for the push-push, push-pull system. You have, first, from Merit, you have several Y connector. You have the Honor, okay? It is a push-pull, same as Squid. The inner diameter is 7 French. So this is really a competitor for Squid and for my shell. The advantage is that it is ergonomic. The manipulation is minimized because it is a push-pull system. But disadvantaging is that there is a poor sealing and there is no equipment blocking. We know that with a push-pull, with simple push-pull, there is no equipment blocking. They need a screwing valve in addition. So they have developed the MBA, which is a push-pull plus screwing system. The inner diameter is 9 French. So the advantages, as I told you, is that there is an equipment blocking, but the ergonomy is poor and it is difficult to screw the valve. To finish for Merit, we have the PhD. The PhD is a push and release. So here you have the valve. You can see that you just have to push to open and then to release, and there is an automatic return to the closed position. So it is the advantage. There is an equipment blocking, but as there is an automatic return to the closed position, it can be a disadvantage because you can have an unintentional closure of the system, and it can damage the state. Then we have the Y-click from Elcam. This is a push-pull system. It is a 9 French, so it is the main a competitor for my shell. The maximum pressure is 40 atm, and it can be used with automatic injector. And there is an automatic switch. There is two positions. You have a semi-open position, an open position, and a closed position. And there is an automatic switch from semi-open to closed position during the high pressure injection. We know that during the injection, the material has to be maintained, okay, and the valve has to be closed. So with that valve, it is automatic. When there is the injection, they have the closed position. The disadvantages are that it is bulky and there is no equipment blocking system. Okay, let's see Guardian 2 from Teleflex. We have the Guardian 2 push-pull plus screw system, and we have the Guardian 2 NC push and release plus screw system. Okay, so the advantage for this sort of system, there are equipment blocking and automatic closing system, but it's not very user-friendly and it is bulky. The Boston Scientific Y connector is the watchdog. This is a push and release screw system, and it is an 8 inner diameter. And same as the others competitor push and release screw. There is a blocking system, an automatic return to the closed position, but you have a risk of stain damage. And to finish, we have the OK2 from Goodman. This is a push and release plus screw system. And the diameter is 10 French, so it is the only one, I think. So it's good to have kissing, to use multiple material in the same time. And there is a blocking system, and you can, there is an automatic return to closed position. And as I told you, there are a lot of other competitors, more and more implanted in Asia, but as well in Europe. There are a lot of copies, low price. Some kits sold by, for example, this kit is sold by Comed, by LePew, by Sony Medical. Okay, but we have the chance in Vigon to have a Y connector, very ergonomic and simple to use. And we have a very good feedback from our customer, and they are on the market for years. Okay, so I have finished with the Y connector. I think everything is clear, but don't hesitate to ask questions in the chat. I know that there are a lot of information, so it will be a pleasure to answer. So now the inflation device. We have two inflation devices in the range. We have the dolphin and we have the flamingo. Just one reminder, when you have an angioplasty, you could have the balloon angioplasty, okay? You have to inflate the balloon, and then you can have the stent angioplasty. And these inflation devices are used during angioplasty to inflate the balloon or the balloon expandable stent. The angioplasty balloon is defined by his length, okay? And it will be chosen to be at the good length versus the length of the stenosis. Okay, so the doctor will choose the balloon to have the same length. Okay, and you have the nominal diameter, and the nominal pressure is the pressure to reach the nominal diameter. You have the rated burst pressure, that is the maximum pressure for this balloon. Okay, so now you have all the information to follow this presentation. Dolphin is used to inflate and deflate balloon during the coronary angioplasty and peripheral angioplasty. You can see here the balloon when it is inflated. So the targets are the vascular peripheral surgeons, the interventional cardiologist, and the interventional radiologist. What are the features of and benefits of the dolphin? Okay, so you have the dolphin. Here is the manometers. This manometer is resistant to 30 ATM maximum, so it is suitable for most of the procedures. Here you have automatic locking system. So the dolphin is very easy to handle, easy to use. You have a syringe volume of a syringe of 30 cc. This volume is suitable for small to big balloons. And this syringe is transparent, so it is easy to remove the bubbles. As you can see, the dolphin has a square shape. It is very stable on the drape. And you have a T-shaped handle. and a connection line with or without stopcock. I think I give you all the benefits. Yes, this dolphin is available with accessories for coronary angioplasty. So it can be sold alone or with accessories. The accessories are the Y connector and the torquer, the insertion gateway, the guide wire introducer. Let's now see a little video to know how to use the dolphin. I think you can't hear the voice. Could you write on the chat and I will just see if you can see, if you can hear. Ils n'entendent pas? Okay, I think it will be okay. I will restart the presentation. Is it okay? I will present you the inflation device Dolphin. The device is used to inflate balloons during peripheral and coronary angioplasty. It has a manometer. The maximum pressure is 30 atm, so it is suitable for most of the procedures. The syringe is transparent to see and removes bubble easily. The maximal volume is 30 cc, so the Dolphin is suitable for small to big balloons. The locking system is automatic. It has a T-shaped handle. The Dolphin has a square shape to be stable on the table. It has a PU connection line with or without a three-way stopcock. First, the preparation. Orientate the Dolphin downward and push button to pull the handle. Fill the device with the mixture of the contrast media and saline solution. Then, orientate it upward and remove the bubble. Release button to lock the device. You can now connect the device to the catheter. The Dolphin is ready for inflation. To inflate, orientate the device downward and inflate by turning the handle. The balloon is inflated. To deflate, push buttons and pull the handle. The needle is on vacuum. Then push buttons and go with the handle. the needle must be at 0. The dolphin is ready for a second inflation. If needed, remove bubbles before the inflation. As I showed you, the dolphin is easy to use and it is very appreciated by users. Okay, so I think you have seen that the dolphin is very easy to use, very simple, very quick. There are these references with or without accessories. I have finished with Flamingo. Let's now discuss about, I have finished, sorry, with Dolphin. Let's now discuss about Flamingo. The indication, Flamingo is indicated to inflate and deflate balloon during mainly coronary angioplasty. It is very appreciated by interventional cardiologists, but it can be used for peripheral angioplasty too. The target are the interventional cardiologists, the interventional radiologists, and the vascular and peripheral surgeons. What are the features and benefits of Flamingo? You have here the manometer. It is a CT-ATM, the same as for Dolphin, so it is suitable for most of the procedures. The manometer is a rotary manometer, so you can handle the Flamingo with different possibility. For example, you can use it like this, or you can use it like this with the two hands. If you prefer the right hand or the right or the left hand, you can use it like this. You have a manual locking system. It is intuitive and quick. The syringe, this is a 20 series syringe, so it is a compact device and light, and that's why it is well appreciated for coronary angioplasty, because when you are in the cath lab, you have less space in the drape, so it is space saving, it is compact, so it is very appreciated for coronary. The syringe is transparent, it's easy to remove the bubbles. You have a sensitive wound handle. That means that you have a progressive resistance of the handle from 12 bars when you inflate the balloon. It can be useful to know, to estimate where you are and if you have to stop. As I told you, I think I told you all the benefits. Yes, it is an ergonomic system. You have a good handling, and it is very simple and quick to lock and unlock the system. This Flamingo is sold with accessories for coronary angioplasty. This is Y connectors kits. Let's now see how to use it with a short video. Hello,
Hello. Oh, تقلقش مع السلامة.
Hello, I will present you the inflation device Flamingo. The Flamingo is used to inflate balloon during angioplasty. It is mainly used for coronary angioplasty, but can be used for peripheral angioplasty too. The flamingo has a rotary manometer, which allows several possibilities of handling. The maximum pressure is 30 atm, so it is suitable for most of the procedures. The syringe is transparent to easily remove bubbles. The maximum volume is 20 cc. The device is light and compact and well appreciated for coronary angioplasties. The handle is sensitive. There is a progressive handle resistance from 12 bars. The flamingo is ergonomic and easy to handle. The unlock system is simple and quick. The flamingo is available as kits with accessories for coronary angioplasty. First, unlock the device. Position the device downward and pull the handle and fill the device with a mixture of contrast media and saline solution. Orientate the device upward and remove bubble by pushing the handle. Then, lock the device. The flamingo is ready for inflation. First, connect the flamingo to the balloon catheter. Then, orientate the device downward and inflate the balloon by turning the handle. Unlock the device. Pull the handle towards you to deflate the balloon. Then lock the device to maintain the vacuum effect. The needle must be unvacuumed. Then, unlock the device and go with the handle. The needle must be unzeroed. The flamingo is ready for new inflation. Before the inflation, check there is no bubbles. Okay, so you have here all the references. You have kits with my shell, for example. You have kits with squid. You have everything to meet the customer needs. To have everything in mind and to be very clear, I have one slide, dolphin versus flamingo. So you have dolphin and flamingo with the same pressure, 30 atm, but the volume is different. It is 30 cc for dolphin, and for flamingo, it is 20 cc. The locking system is automatic for dolphin and is manual for flamingo. The T-shape handle, the handle is a T-shape for the dolphin. This is a rim shape for the flamingo. And for the use coronary and peripheral for both, but mainly coronary for flamingo. Regarding the inflation device speed, we know that the majority of the physicians prefer fast inflation devices, and dolphin and flamingo are fast inflation devices. The flamingo is faster than the dolphin, but the dolphin and flamingo are not the fastest inflation device on the market, but they are faster than some inflation device. For example, the basic compact for Merit is very slow, very slow. I can't tell that, but it's not very fast. So when you have a physician who used to have the basic compact from it, you can warn the physician and say, okay, it is the dolphin or the flamingo, it is faster than the basic compact, for example. Regarding the competition, this is the main competitor. I think there is some sound. Sorry for the. Can you switch off your microphone, please? It's okay. Thank you. So yes, we have the main connector. We have the Encore 26, the basic range, the QL range, the Everest, and the Presto. The QL range, Atrion is a very good competitor. They have a lot of efficient devices, which volume you have 20, 25, 40, 60 is for gastrology, for example, and they have a choice of pressure, but they're all very compact. They have a few range, but with this device, you could have a risk of accidental locking and unlocking sometime. And you will see that numerous companies have a QL efficient device customized for the company in the run. So we'll see this this efficient device in numerous companies. Then we have Merit. There are a lot of efficient device. You have a very famous Basic Compact. Okay, this is the main competitor for Flamingo. The advantages is that is it compact, it is easy to handle, and it is a disadvantage. It is very slow to inflate. You have, for example, the basic touch. Sorry, it is a competitor for Dolphin. The volume of the syringe is 30. The maximum pressure is 35. And the advantage is that it is easy to handle, but it is bulky. And they have a 40 ATM device. This is the basic touch 40. So the advantage is that it is a 40 ATM. It is used mainly for fistula or for high pressure balloon. You have the Boston Scientific. You have the Encore 26. This is the competitor for Flamingo. The volume is 20 cc. The maximum pressure is 26 atmosphere. So it is easy to handle. It is compact. The limitation is that the maximum pressure is 26 atm. And in the range, I told you that numerous companies have an Atrion is the range. They have the Encore 40, which is the QL, and the volume of the syringe is 25, and the maximum pressure is a 40 atm. It is easy to handle and compact, but you have the risk of locking and unlocking. Then you have the BARD inflation device. This is the Presto. The volume is 30 cc and the maximal pressure is the 40 atm. The advantages I have, why the price, it depends on the market. So perhaps in your country is not the case. So I think I can remove the price, but it's because it's very different between countries. The advantage is it is a 40 ATM, and the disadvantage is that there is no self-locking system. And you have the Everest for Medtronic. This is the competitor for Flamingo. You have a good handling. It is like a gun, but it is very bulky. And then you have other competitors. You have a lot of competitors from China, from India, with low price. You have often copies of well-known inflation device. For example, here you have a Dolphin from Sony Medical, or you have Flamingo Dolphin. I don't know, it is a mixed from another company. But I think the quality is not the same. We have this product on the market for years. We have very good feedback. So I think it's important to say that to the doctors that we have the quality is guaranteed. I have created marketing tools to help you to have information and to sell these devices. For Flamingo and Dolphin, you have a brochure, you have sales pitch. In this sales pitch, you have a short description of the device, you have the advantages, and you have a little sales pitch to adapt for your customer, to have the most important information. You have some answer to objection. So I think it will help you to have all the information to promote these devices. And as you can see, we have video. You have seen them in the presentation. So to conclude, Dolphin and Flamingo are French product. Dolphin is on the market for more than 20 years. So it is very reliable. It is suitable for most of the procedure, highly appreciated. We have very good feedbacks, and it is easy to use, easy to understand, easy to sell. The inflation device are products that are very easy to solve. You don't have a lot of trainings, so they are good point to discuss with the doctors. For Flamingo, the Flamingo is on the market for more than 10 years, so this is the same. It is reliable, very appreciated by cardiologists, and it is simple, it is easy. And you know that the endovascular market is highly attractive and in growth, so you have a lot of opportunities to sell these products. Okay, so now we have discovered the Y connectors, the inflation devices. I will finish with the seal one. This is a radial compression device. So before starting the presentation on the device, I think it's important to have some information. First, I think you have heard that you can have a femoral access for angioplasty and a radial access. And why should the radial access instead of the femoral approach? First, because there are less complications. There are reduction of major bleeding. There are less hematomas. The patient can have a earlier ambulation, and the outpatient procedures is possible. That's why coronary angiography and angioplasty are performed mainly by radial access, but some are made by femoral access if it's impossible to have a radial access. Peripheral and neurovascular angiography and angioplasty are mainly performed by femoral access, but the radial access is in growth. So you have to have this in mind. And for the embolization purpose is to plug the blood vessels to make up or feed the lesion, okay? And for embolization, there are many performed by femoral access, but there is a growth on the radial access. So you could have opportunities to sell the SIL1 for the targeted doctors. The anatomy of the hand, you have two important arteries to know. You have the radial artery, which is on the thumb side, and you have the ulnar artery on the little finger side. And if you have an occlusion on the radial artery, the ulnar artery will take over to bring the blood to the hand. So you can ask you, why use a compression device? The compression device is used at the end of the angiography or the angioplasty performed by radial access. You will have to remove the introducer, okay? So you need to compress the radial artery at the puncture site. with the device to close the artery. So the indication of the radial artery compression is of the SIL1 is the radial artery compression at the end of an angiography and an angioplasty. Coronary angioplasty, peripheral neurovascular, rarer, but it's possible, and embolization performed by radial access. That's why the targets are interventional cardiologists, interventional radiologists, interventional neurologists, and vascular surgeons. It's important to know that the radial compression device is placed by doctors or by nurses, and the patient follow-up until the removal of the SIL1, because the SIL1 will let in place for 1, 2, or 3 hours, is made by nurses. Let's now discover this device. First, the compression and decompression mechanism. Okay, so it is here. You have the compression, decompression wheel, and for the compression, no syringe is needed, so the patient follow-up is facilitated. You will see that for the main competitors, Tirabond, you need a syringe. There is a compression decompression scale, so you have a presage management of the compression and decompression. You know the compression level, and you know the decompression. Here you have the safety button for decompression. It allows to prevent an unexpected decompression by the patient. This is a safety button. Here is the compression pad. It is a very precise compression pad, so you have a precise compression on the radial artery. Regarding the indicator, you have here the transparent pad with the central landmark, and you have a high visibility because it's transparent. You have a high visibility of the puncture and compression site. You have here a time indicator to indicate the beginning of the compression, so the patient follow-up is facilitated. Regarding the wristband, you have here a large, soft plastic band. The SIL1 is comfortable for the patient. There is no damage on patient skin when the wristband is removed. With Tirabond, sometimes you have some damage. Here you have the rigid part. It's important to have a firm support during the compression. And here you have the safety clip. It is important to prevent unexpected removal by the patient. So let's now see how does it work. I think for the moment it's not very clear for you. So first you will have the product characteristic. Okay, so let's see the concept. So to increase the arterial compression, you have to turn the compression wheel clockwise, and you will see that the compression pad will go down. To decrease the arterial compression, you have to press the safety button and to turn the compression wheel simultaneously clockwise. The pad will go up. Let's now see the device placement. It is very important. We have seen that the pad is precise, so you need a precise placement. First, sorry. Yes, first you have to check if the compression wheel is at 0, and you can set the device placement time. Then you withdraw the introducer sheet 2 to 3 centimeters, and you position the device. You have here the skin puncture sites. We will see just after that when you have a Sedinger puncture, you have an angled puncture. So you have here the skin puncture site, and the compression of the artery has to be at 0.5 centimeter, approximately proximal to the puncture site. We will explain that just after. If it is impossible to well position the C1, it is because the patient has a small waist or the puncture is off center. So you can use an adapter pad. The adapter pad is in the pouch with the C1, and it can be added if the doctor thinks it is necessary. Then you have to fasten the wrist strap. Be careful. I'm sorry, because when I click sometime the presentation, okay. And then you have to fasten the wrist strap. And be careful to not pitch the skin, okay? The wristband has to be slightly taut, for example, with a one, I think, when hold more than for watch, okay? Okay, and then you fold it back off itself. The artery compression. So first you have to start the compression. You compress by turn the wheel clockwise to level 3. And then you remove the introducer sheet. You can compress until the drop of blood disappears. Yes, the bleeding stops. And then you have to adjust the final compression level. So you have to decompress until a bleeding appears, and then you just have to compress another time. And then you have a precise adjustment of the final compression. Okay, so the final compression level is at 6. In this example, this is an example. For all patients, it is different. So just an example. Then you have to decompress. The decompression will be proceed step by step. After 30 minutes, you can decompress. For example, if you have at level 2, you will go to the level 4. If there is bleeding, you have to compress to 5. After 15 minutes, you can go to level 2, and after another 15 minutes, you can go to level 0. Sorry, there is some noise. Could you switch off your microphone? Okay, thank you. When you are at 0 decompression level, you have to wait at least 15 minutes before the removal. If there is no bleeding, you can remove the device. You have to remove it carefully to not damage the skin. It's very important to know that the decompression time is patient dependent, and it varies according to comorbidities, the procedure of the duration, if the patient have anticoagulation or not. So this video is for an angiography, a simple procedure, and for an angioplasty could be longer. So it have to be adapted for patient. Okay, this slide is to explain the Seldinger technique and explain why we have to place the seal1 at 0.5 centimeter. When I think you know that, but I prefer to explain when you puncture the skin, okay, you will puncture it with an angle of 30 to 60 degrees. So when you puncture here the skin, you will have the puncture artery here, okay? So if you want to compress the artery at the puncture site, you have to place the seal1, the central landmark here. And it is approximately at 0.5 centimeter. It depends of the angle of the puncture. When you have positioned the seal1, you have to withdraw the introducer sheet just to have a little think in mind. The clock indicator is on the little finger sides. It's important to have a report to be comfortable when you will present it to the doctor. And if the base when you position the device is the base is not against the patient properly, for example here we have placed the central landmark at 0.5 centimeters, okay, proximal to the skin puncture seat, but we see that here there is a space between the transparent base and the wrist. That means that you need to add the adapter pad because the patient has a small wrist, or this is the puncture site is eccentric. For example, this is the same example with the same patient, but you can see that you have the skin puncture site here, the central landmark is well positioned, and you have the adapter pad, and it is well positioned against, again, the patient's wrist. If the doctor try with the adapter pad and it's not okay, he could remove the adapter pad and follow the procedure without. It's possible to test, to try, and to remove. This adapter pad is in the pouch, so you have only one reference who fits almost every patient risk. And it is all the competitors have 2 references, for example. Some tips and tricks to have in mind. First, you have to carefully clean and dry around the puncture site, okay? Because if it's not dry, the seal1 can move, so it's important. As I told you, you have to place it correctly. It's important to define the most appropriate level of compression because it's better to not compress the artery too high if it's not necessary, okay? And it's important to be sure that the radial artery is not obstructed. So you can perform the reverse Barbeau test. When I go to a cath lab, I see doctors and they don't perform the reverse Barbeau test, but when it is a training or for the learning curve, I think it's important to be sure that the radial artery is not obstructed. And it's important to decompress in several steps. You have, I think you understand because I told you, as you have a precise positioning, it's important to train the teams. The training is the key of the success. If the team is well trained, it will be a success and they will love the seal1 and they will use it for years. Okay, so you have to take time at the beginning and then it will be very easy and you will have sales every 4 years. So first, you have to train all the staff, the physician, and all nurses who will take care of the patient until the removal. So it could be the nurses in the cath lab, but it could be in the room just before the patient leaves. For this, we provide tools, poster, video. You will see that just after. And I think it's very important to have a follow-up for the first few months. And if they are masters of seal1 positioning, they will very satisfied. And we have customers who use the seal1 for many years. And I went to the cath lab. I see last month 3 customers, and they really love this product. So it's very interesting. Just a few words about hematomas. You know, then you puncture an artery, you could have an hematoma, and sometimes the hematoma could be due to a bad positioning of the compression device. So it's important to position precisely, but now you know that. And in case of hematoma, the team will follow the hematoma hospital protocol. Now you have a live case to see how it's used in the cath lab. There is no sound, it's normal. Okay, so it's the doctor clean and dry around the introducer. Okay, then he position the seal1. You can see the introducer sheet. When it's well positioned, we will okay. And then he will adjust the compression level So as you can see in this video, the doctor has not the protocol, exactly the same protocol in our video. All doctors will adapt the protocol. Okay, you will explain with the protocol, but we know that the team, perhaps for the team, it's difficult to see the patient every 50 minutes. But they could see the patient every 30 minutes. I think 30 minutes is a good time because it is longer enough for the team. And sometimes the doctor will not personalize the compression. For example, for each patient, he will compress to level 6. Okay, so we have some points in our protocol which are important to have the very good compression, but we have to deal with the doctor because they have some other he can adapt the protocol. As I told you, we have one sterile reference, okay, for all the patients, and we have a non-sterile. We have the chance to have some clinical studies for SIL1, and last year we have 2 new studies. We have there are studies very independent from hospitals, so we are very happy of that. I will resume 4 studies just now to show you that the SIL1 is very used by doctors and have very good results. So first, we have a clinical study. This is a comparison of the SIL1 and the tear band after an angiography and a coronary angioplasty. The item studied is the patent hemostasis, the total compression time, and the local complications. And the results, the compression is shorter with SIL1. Regarding hematoma, no more hematoma with SIL1 than with tear band. This is not significant, but there are no hematoma grade 4 and 5, and very few hematomas grade 2 and grade 3. No occlusion of the radial artery and no other complications at discharge. So they are very good results. You see that the compression is shorter with SIL1, and it's very important to have a short compression time because the occlusion rate depends on the compression time. If the compression time is shorter, the occlusion rate will be lower. So it's very important to have this in mind, and this is significantly shorter with SIL1. We have another, it's not a clinical study, it is a clinical study, but it was presented to PCR. It is not published, but this is the compression between SIL1 and tear band, and the medical team have analyzed the bleeding. One thing we can see is that the decompression protocol for SIL1 and for tear bands, for SIL1, it is shorter. For angioplasty and for patients with anticoagulant is shorter than with tear band. And the results for bleeding, with SIL1, the decompression is shorter. There is no significant difference in bleeding with tear band, and there is no bleeding after 30 minutes of recompressions. So they are very good results. Then we have 2 studies from last year. I have to explain you regarding the radial access. I explain you that you can have the femoral access and the radial access. And in this study, the SIL1 is used on the distal radial axis. Just one picture. Here you have the proximal radial axis. This is the common radial axis, okay? And now some doctors, since a few years, but not a lot, they perform angioplasty or angiography by distal radial axis. And the advantages of distal radial axis, it is more comfortable for the patient, more comfortable for the doctor, especially on the left side. The doctor don't like the left side because it's complicated, and with the distal axis is easier. You have an easier compression because the artery is superficial. You have a shorter compression time and a reduction of the occlusion rate. We have a study. In this study, This study is to compare the distal radial approach and the proximal radial approach for carotid intervention, and for distal and proximal, SIL1 is used, okay? And they have studied the complication state and the major event. The intervention success are 100 for distal and approximately 100% for radial. So it's a very good result. And there is no asymptomatic occlusion on the distal group, and 3.3% on the proximal, no symptomatic occlusion. All the cases are with the SIL1, so there are very good results for SIL1. And for the last clinical study, this is for superficial femoral artery intervention. The hemostasis achievement with a compression system is one of the points of the study. And the distal radial access, the procedure with distal radial is performed with the SIL1, and the proximal radial with TR-band. And in that clinical study, you have to keep in mind there is no major complication with SIL1 and a very low rate of hematomas. So these studies shows that first, SIL1 is used in studied protocols, and there are independent clinical studies, so it's very good things. The compression is shorter versus TR-band, and the hematoma and complication is not significant versus TR-band, and for the same access, and it is very low. Okay, I know that there are a lot of information for SIL1, but it's very an interesting product, and I want that you have all the information. Let's now speak about the competition. Regarding the type of compression, you can have the compression by a homemade device. This is a roll of swabs. You can have a compression, a mechanical compression, for example, with the SIL1. You can have a pneumatic compression, for example, with the TR-band, where balloons are inflated. And you have a device which include pad impregnated of procoagulant material. There are a lot of competitors, but the main competitors is TR-band from Terumo. TR-band consists of a transparent with strap, 2 compression balloons, an ejection port, and a syringe. And the compression is performed by inflated balloon, and the decompression by deflated the balloon. So the syringe is needed for decompression, and the wristband is not secure. This is a Velcro system. So this is a disadvantage again, compared to the SIL1. there are two references, so it's more, yes. Okay, so here I have all the advantages. The seal one, yes, is all in one. You have a compression indicator, the puncture site. You have the visibility because the central landmark is transparent. You have a time indicator. You have safe fastening, so it is secure, and the compression time is shorter. So the seal one is a secure, a very comfortable, and a very performant system for the compression. Now you have the Medtronic compression system. This is a mix of the seal one and the tear band. You have a syringe to inflate, but you don't need the syringe for the decompression. And it's not secure. And you have two references. Here, this is the safeguard radial from Merit. It is similar to tear band, so the advantages and disadvantages are the same. And for Merit, you have the Prelude, and it's very similar to the tear band. And you have now the Prelude Think Distal, which is used for the distal access. And to finish, this is an example of a compression device with pad impregnated with procoagulant material. And you have a lot of other competitors, but there are a lot of copy from tear bands, and we don't know really about the quality. The marketing tools. For this product, you have a lot of marketing tools. You have the brochure, you have a user guide, a poster to add in the cat lab. You have a sales pitch with all the benefits, with the answer for objection. You have publication, and I have created a document with all the information in short documents. So you will have all information for each publication. And you have live case videos and 3D video. So to finish, the seal one is French. He is in the market for 10 years, so it is reliable. The compression is precise and secure. It is comfortable, and the management is facilitated because no syringe is required and there is only one reference. I have finished with seal one, and to finish all the training of the presentation, I want to show you just one slide to know the opportunity for one target. When you are in the cat lab, you have the interventional cardiologist, for example, for 100 coronary angiographies. You can sell 100 compression devices. You can sell 100 smart pack. If there is 100 coronary angiographies, we know that for coronary, you will have approximately 50% of coronary angiography are followed by coronary angioplasties. In the same time or not, it depends. If it's not in the same time, you will have 50 compression device in addition, okay? But if it is in the same time, you will have 50 hemostasis valve. We saw that it is used during coronary angioplasty, and you will have 50 inflation devices because for PTCI, for coronary angioplasty, for each coronary angioplasty, an inflator is required to inflate balloon or balloon expandable stent. So with this slide, you can see that for one target, you have a lot of product. You have here I have had the smart pack. If you were at the training yesterday, Elodie explained that it is a pack with drape and gallipot and things like that. All component for all basic component for the angiography, angioplasty. So you can see that you can sell 4 products for an international cardiologist. So I have finished my presentation. I hope everything is clear. I'm sure that you have questions, so you can answer your question in the chat. We will answer you very quickly, and it will be a pleasure to have this training with you. And don't hesitate if you need. We are here to help you and to give all the information. And I hope you understand that the interventional products are simple products and they are very easy to sell. You don't need an important information and important training. It is very easy. Thank you. And don't forget that you have the training tomorrow with Elodie. This is the training for grafts. Yes, for grafts. Thank you. Bye-bye.
Thank you.
Thank you.
Thanks very much from Cyprus. Thank you very much, my dear.
Thank you. Bye.